Go ahead.
Okay, my name is Dulce Reyes. I am a student at Maryville University, and today I'm going to do my head-to-toe assessment. This is a requirement for health assessments. And the volunteer I have today is Les Hera. I already submitted the history, the HMP. So this gentleman, his vitals were normal. He weighs 205 pounds. His BMI is 27. He is 6 feet 1 inch tall. He has normal bowel and bladder control. We went ahead and did the Snell vision test, and he is 20/20 left and 20/20 right. So we're going to go ahead and start off with the cranium. I'm going to go ahead and palpate and make sure that he doesn't have any masses, any lesions, anything abnormal that I should notice. So I'm just going to go ahead and palpate. His hair is nicely and distributed, and his hair is clean, shiny. Does that hurt when I do this?
No.
Okay. So the next step, what I'm going to do, I'm going to go ahead and check for his facial bones. So I'm going to go ahead and just put pressure. Does that hurt?
No.
Any pain?
No.
Okay. Now I'm going to go ahead and ask you if you could go ahead and open your jaw. All right. So we're not supposed to feel any pops or any clicks. Okay. Our next step, I'm going to go ahead and palpate his sinuses, and I'm just going to go ahead and tap. And if it's tender, you let me know, okay?
Okay.
We're going to do maxillary. Any pain?
No.
Okay. All right, we did frontal and maxillary. Now I'm going to go ahead and assess his cranial nerve 5. In order to do that, I'm going to go ahead and grab a Q-tip, and what I'm going to have you do is close your eyes, and I'm going to go ahead and touch you with the soft part of the tip, and you're going to tell me yes if you can feel whenever I'm touching, okay?
Okay.
So you just say yes every time I touch.
Yes. 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 Yes.
Okay. The next step, I'm going to go ahead and check with a sharp tip, okay? And we're going to do the same number. Whenever you feel it, you're going to say yes, okay?
Okay. Yes. 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 Yes.
Okay. Now, the next step, we're going to go ahead and check his cranial nerve 7. And in order to do that, I'm going to have you close your eyes. I need you to squint. Okay, now open your eyes. Now I need you to stick your tongue out. Okay. Now I need you to show me a big grin. Right. And then I also need you to wrinkle your forehead. All right. And then I need you to inflate your cheeks. Now I'm going to go ahead and put pressure, and I need you to keep the air in there, okay? All right. Perfect. And then the last step, I need you to clench your teeth. And the reason why I need to do that is because I need to check his bite. So for our next step, we're going to go ahead and check his eyes. I'm checking for symmetry. His eyelids, they close on without any problems, and they're symmetrical. He's blinking involuntary. I'm going to go ahead and have you close your eyes because I'm going to go ahead and palpate. I'm going to go ahead and make sure there's no drainage, swelling, or any lesions. And there is no drainage. The next thing I'm going to do, I'm going to go ahead with my pen light, I'm going to go ahead and take a look at your conjunctiva and your sclera, okay? So I'm going to go ahead and pull your skin down. And the sclera is why conjunctiva is moist and pink. And we're going to do this on to both eyes. Okay. So the next step, I'm going to go ahead and check his cranial nerve 3, 4, and 6. And that would be to assess his extraocular movements. So the first thing I'm going to have you do is look at me. I'm going to go ahead and flash the slide, and we're going to go ahead and do it on both sides, okay? So his pupils are reactive. He went from a 5 to a 3, and they're equal. So the next step, I'm going to have you cover one eye, please. I'm going to go ahead and look at me, uncover it. Alrighty, and then we're going to do it to the other one. Uncover it, and I'm checking for accommodation. And then the next step is go ahead and cover. Actually, no. Let's go ahead and have you follow this pen, okay? So now you don't move your head. All I need you to do with your eyes, follow this pen. Ready? Okay. And then my next step is I'm going to go ahead and check his peripheral vision. So with one hand, cover your eye. And then let me know whenever you see my fingers on the periphery, okay?
Now.
Now you go ahead and look at me, okay? Ready?
Okay. Yep. Yep.
All right. Let's go ahead and do it with the other eye.
Yep. Yep. Yep.
Okay. All right. The next step I'm going to use the ophthalmoscope, and I'm going to go ahead and check for his optic nerve. All right. So you don't have to look at me. You can go ahead and point your side to this spot right there. Okay. Okay, well I can see his optic disc, and it's well defined. It's got a yellowish, pinkish color, and I can see the vessels in and out. And we would do the same thing for both eyes. For this video, I'm just going to go ahead and just check one eye. And since we did the Snell test, and that one is to check visual field and visual acuity, and like we said, he is to the right 20/20 and to the left 20/20, and that also checks for cranial nerve too. Okay, my next step, I'm going to go ahead and check his ear. I'm going to go ahead and palpate the auricle, make sure that it's not swollen, tender, any lesions. We're going to do it on both ears, and his ear sits at the right area because it's aligned to the inner campus. I'm going to go ahead and check with the otoscope. Now, we're supposed to do it on both sides. For this video, I'm just going to go ahead and check this side, okay? Okay, I can see his optic landmarks, the membranes, and they are pearly gray. Very minimal cerumen, no redness, no swelling, no drainage, no lesions, no foreign objects. Now, my next step, I'm going to go ahead and do the whisper test. And in order to do the whisper test, I'm going to whisper something in your ear, and on the opposite ear, I need you to rub your fingers together, okay? So let's go ahead and start with whichever you want first.
Flower.
Okay, let's do it to the other side.
Rose.
Okay. The next step, we're going to go ahead and check cranial nerve 8, and that would be the Weber test. And we have a tuning fork for this. So what I'm going to do, I'm going to strike the tuning fork, I'm going to sit it on the top of your head, and you're going to let me know if you can hear the sound on both ears, okay? Are you ready?
I am.
Okay. The next step, we're going to do the Rhine test. And the way we perform the Rhine test, we strike the tuning fork and we sit it on the back of the mastoid, and then we do it to the front side. The way we're going to do it, whenever I strike and sit the tuning fork, you're going to let me know whenever you stop hearing the sound. And instead of using any word, I rather, let's just go ahead and have you raise your finger, okay? All right, and this is something that's done to both sides for purposes of time. We're just going to do it on one side. Okay, we're going to go ahead and do it on the front now. Okay, so a normal result is the sound is you can hear it longer when it's going through air versus when it's going through bone. And in this situation, it was normal. He was able to hear a lot longer when we did on the to the front instead of the occipital. I'm sorry, mastoid. So our next step is going to be to check for cranial nerve 1, and there's several ways that we can do this. We can have samples of different odors and see if he can differentiate them. We don't have that, so for this project, I'm just going to go by his history. So for my patient, I would ask, do you have any changes on your sense of smell or taste? Something that you can tell that, or that you can share with us that can tell us there's been some changes and it's not normal for you?
No.
Okay, so that would be the way that you would be able to test cranial nerve 1 if the patient reports any changes. Now my next step is going to check his mouth. We want to go ahead and make sure that it's nice and moist. You can go ahead and open your mouth. And his oral mucosa is nice, moist, pink, no lesions, no sores, no bleeding of the gums. There is no cavities. Okay. Uvula is at midline. Now, the next step that we're going to do, we're going to check cranial nerve 9, 10, and 12. And the first thing we're going to do, we're going to check his gag reflex. After checking his gag reflex, we're also going to check movements with his tongue. So, if you can just go ahead and open your mouth for me. Okay, so he has a positive gag reflex. And so our next step is, I need you to stick your tongue out, and then I need you to move it up and down. Yeah, okay. Now, your tongue needs to go from side to side. Okay. Now the next step, I need you to, your tongue needs to touch the inside of your cheek, and I'm going to put pressure, and you need to go against the resistance, okay? All right, let's do it on the other side. Okay, perfect. And our next one is we're going to check his neck, and we're going to check cranial nerve 11. So the neck is supposed to be equal on both sides, no masses, no bulges, no lesions. We can see the trachea is midline. And then the next step, in order to check cranial nerve 11, I'm going to have you shrug your shoulders, and I'm going to push down, and I need you to go against the resistance, okay? All right. Now your head, I need you to tilt it from side to side. Does that hurt? Okay, I need you to go against resistance, so I'm going to put my hand against your head, and you're going to go against it, okay? Let's do it. All right, let's do it to the other side. Okay, that's perfect. So now we've completed cranial nerves 1 through 12. My next step is we're going to go ahead and check his lymph nodes. And we're going to go ahead and start with the preauricular, postauricular, occipital, tonsillar, submental, submandibular, the posterior internal cervical, anterior, subclavicular, axillary, and the last one is cubital. Okay, I'm just going to have you relax your arm. Okay. And there's no abnormalities, no hard lymph nodes, nothing that it's abnormal. Then I'm going to have you swallow. Go ahead and swallow. And I can see his thyroid moving down. Okay, my next step, we're going to go ahead and check upper extremities. If you can go ahead and relax your arms, I'm just going to go ahead and go down your arms. And is that tender? Okay, no. I'm feeling his skin, making sure that it's nice, warm, and dry, no lesions, no changes on the skin color from arm to the rest of the body. I'm going to go ahead and feel for his brachial pulse. Just a 2+. And then I'm going to go ahead and feel his radial pulse. 2+. I'm going to go ahead and look at his nail beds, and they're nice and pink. Normal nails. Less than 2 seconds capillary refill. No clubbing. Skin is normal. Okay, my next step, I'm going to go ahead and check his torso, and I'm going to go ahead and start with the back. Do you mind turning this way? Relax this way. So his skin is normal. There is no moles, rashes, skin lesions, anything that's that would look abnormal. Okay, so my next step, I'm going to go ahead and palpate his back, and you're going to tell me if that hurts. Is that tender?
No.
Okay. Okay, in the next step, I'm going to go ahead and feel for tactile fremitus. And what I need you to do is say 99, repeat it several times, and I'll tell you when to stop. Go ahead.
99, 99, 99, 99.
Okay, again.
99, 99, 99, 99.
All right. Okay, and then the next step, I'm going to go ahead and check his thoracic expansion. What I need to do is on his 10th rib, I'm going to set my thumbs, and I'm going to have him take a deep breath, and I'm going to measure the movement. Typically, the normal is 3 to 5 centimeters. Okay. So can you go ahead and take a nice deep breath? Alrighty. Go ahead and exhale. Okay. Okay. Now my next step is I'm going to go ahead and do indirect percussion, and I want to listen for resonance and not dullness. Okay. So we're going to go ahead and And then my next step is to check for diaphragmatic excursion. And the way I'm going to do this, I'm going to have him take a deep breath and hold it. And then I'm going to do an indirect percussion. I'm going to go ahead and measure the spot where I can start hearing dullness. Okay, and then once I measure that, I'm gonna have him exhale and hold it, and I'm gonna do the same number and then measure where I hear, start listening dole sounds. Okay, so first I'm gonna go ahead and have you inhale and then just hold it, okay? Tell me when. Ready? Hold it. Okay, you can breathe. I'll just have you take a few breaths, okay? Okay, are you ready?
Yes.
Okay, now I need you to exhale it and just hold your breath, okay? Let it all out and hold it. Okay, let's do it one more time. Ready?
Yeah.
1, 2, 3. Okay. I'll go ahead and measure this. And we have 1, 2, 3, 1, 3 centimeters, so that's normal. And then my last step on his back is just go ahead and do a regular auscultation. And you just go ahead and take normal breaths, okay? And I'll tell you when you need to take deep breaths. Deep breath. In and out, okay? In and out. In and out. In and out. Okay. In and out. Okay. In and out. One last time, in and out. One more. Okay. And his lung sounds are nice and clear, no wheezing, no rhonchi. Okay, and now the next step, we're going to do exactly the same thing that we did, but we're going to do it to the front now. So if you can go ahead and face the camera for me, please. So we're going to go ahead and feel for crevitus again, and I'm going to put my palms, and you're going to say 99, okay?
99.
Okay. So go ahead.
99. 99. 99. 99.
Okay. Let's do it one more time.
99. 99. 99. 99.
All right. I'm going to go ahead and percuss just like the way I did to the back, okay?
Okay.
And I don't want to hear dullness, and his is pretty normal. I'm going to have you raise your arms up so I can percuss your sides, okay? You can put your arms, there you go, perfect. Okay. All right. You can put your arms down there.
Sorry.
No, you're fine. I'm going to go ahead and listen to your breath sounds from the front, just like the way I did to the back, okay?
Okay.
And this time I'm going to go ahead and start with the sides first.
All right.
Nice deep breath. Okay. Nice deep breath. Okay. In and out. In and out. Okay. In and out. Okay. In and out. Feeling dizzy?
I am.
Okay. One last time. Perfect. And again, he's got clear breath sounds. The next thing I'm going to do, I'm going to go ahead and listen for his heart sounds. The first heart sound that I'm going to look for, try to listen, is the aortic valve, and that's located on his second intercostal space. Okay, and now I'm going to go ahead and listen to the pulmonic valve, and that's in the second intercostal space. And I'm going to go ahead and listen to first point, which is in the third intercostal space. And I'm going to go ahead and listen to the tricuspid valve, and that's in the fourth left intercostal space. Okay, and the last heart sound is the mitral valve, and that's also considered the PMI, and that's in the right fifth intercostal space. Mid-clavicular line. And I can hear his S1, S2, regular rhythm, no S3, no murmurs. Okay, now my next step, I'm going to go ahead and have you lay down. And just so you know, this recording where the ER is next door. Okay, so with my pen light, I'm going to go ahead and flash my light on the side so I can assess for contour, any shading. I could see if there's any unevenness in his abdominal area. So. And the skin is normal. There's no lesions. There is no rashes. And we do it to both sides. Now, the next step, I'm going to have you raise your head up, not yet. And the reason why I'm going to do that is because I want to see if he has any hernias in his abdominal area. So go ahead and raise your head up. And so you can put up. So there's no hernias. Usually if he were to have one, you could see a bulge in him whenever the patient raises his head up. The next step, I'm going to go ahead and listen to the aorta. I'm going to go ahead and listen to the rest of his abdomen. I'm going to listen to all 4 quadrants. I'm going to go ahead and listen to the iliac artery. Now he's wearing shorts, so and he doesn't feel comfortable exposing his skin. So what I would do with the bell of my stethoscope, I would listen to the iliac artery on both sides. For purposes of this video, we're going to say it's 2+. He was 2+ on brachial, he was 2+ on artery. And then we'll go ahead and whenever we check extremities, we'll check his the dorsalis pedis and the my mind went blank. Okay, so we're gonna go ahead and do palpation. Well, I'm sorry, we're gonna go ahead and percuss. And typically the stomach, the abdomen should be, you could hear high resonance. The only spots where you would hear dullness is when you're going over the spleen and the liver. And I'm going to go ahead and try and do a measurement of this liver. And the way we do it, we're going to go ahead and start down here and start percussing until I start hearing a dull sound. Okay, and then we're going to do the same, and we're going to start on the top. And the normal measurement for the liver, it should be anywhere between 6 to 12 centimeters. His is 10, so he falls within the normal range. The spleen is a little bit harder to measure, and and typically if you're going to be able to listen, it would be somewhere between the 6th and 9th rib. I'm sorry, the ER is very distracting. My next step, I'm going to go ahead and do palpation. I'm going to go ahead and feel your abdomen. I'm going to try and see if I can feel any bulges or any masses. And you let me know if I'm hurting you, okay? Is that comfortable?
Yeah.
All right. And since he can tolerate that, we're going to go ahead and do deep palpation, okay? I'm going to try and see if I can feel the edge of your liver. I'm going to put my left hand under your flank area, and then I'm going to have you take a deep breath and hold it, okay? Okay, got it. So you can barely feel it. You would not be able to feel that with the spleen. If you were to feel it, that means that your spleen is inflamed, or there's some kind of inflammatory process going on. Then my next step is I'm going to go ahead and check the lower extremities. In his legs, there's no varicosities, there's no swelling. His hair is normal, evenly distributed. There's no shining on the skin. And I'm going to go ahead and check for his popliteal pulse. Okay, and we'll do it to both. And then we're going to go ahead and check his dorsalis pedis. Sorry, does it tickle you?
I'm very ticklish, yes.
Okay. Okay, they're nice and strong. It's a 2+. And then I'm going to go ahead and assess the one I went blank. It's the posterior tibial. Just on the inside. Yeah, it's nice and strong. Okay. And now, the last thing I'm going to have you do is I'm going to have you stand up, and I need you to squat. And if you can just squat right there. And then when you're done squatting, I need you to turn around, bend over, and so I can check your spine, okay? So go ahead and does that hurt?
No.
No? Okay. Now go ahead and turn around and go ahead and bend over. And I need your butt to be nice and straight. There you go. Okay, so his spine is nicely aligned. There's no curvature, and we already assessed the back. But again, you know, the skin is even, no moles, no lesions, no rashes. I'm going to go ahead and check your spine, and you let me know if that hurts, okay?
Okay.
Okay, and everything is normal. I'm going to go ahead and have you sit down, and there's one step that I forgot, and I'm going to go ahead and do it right now, is check his carotid. When I was checking his neck, I'm going to go ahead and put pressure. Feel it, it's nice and normal. And then I'm going to go ahead and listen to see if I can hear a breathing. Now I need you to hold your breath. Okay, breathe. And then we're going to do it on the other side, okay? Okay, there is no breathing. And this concludes my video. Thank you very much.